There are minority populations that have significantly increased risk of colorectal cancer. Black populations in general have about a 20% increased risk of developing colorectal cancer and a 40% increased risk of dying from it. Unbelievably, the lifetime risk of a black man dying from colon cancer is 1 in 41. It's just unbelievable. And here's a disease that we can actually prevent. We need to do whatever we can to identify and target those populations where we're going to have a huge amount of benefit if we can just make sure that those people are able to receive the screening that they deserve. Colorectal cancer incidence, unfortunately, has increased significantly amongst certain populations. Amongst younger people, less than age 50, it's gone up by 20% over the last 10 years. But in rural populations, this number has gone up by 35% in the last 10 years. Amongst Hispanic populations, 45%. So interventions that we can do to make sure that these services are available to those underserved populations are extremely important. This can be done through patient navigation in order to identify those people and make sure that there are easy ways for them to access care that are affordable and acceptable to those patients. It's important that we make sure that those are available in language that's not only at their reading level, but is also the language that they choose to speak. So finding ways to do that equitably is extremely important. One of the least screened populations that we have in the United States are uninsured Hispanics who receive colorectal cancer screening at less than 20% of recommendations. Overall population, that's far below where we're at. We're about 2/3 of the general population are receiving colorectal cancer screening, so less than 20% is incredible. We need to do whatever we can to actually target and identify those populations where they would really benefit from access to screening.
Getting cancer screening done equitably is a challenge. I work primarily this is a safety net clinic. It's an FQHC lookalike clinic. A lot of my patients are uninsured or underinsured, and their access to getting screening done is maybe not as equal as someone who has more financial means. A colonoscopy, if you have any kind of insurance, is a level A screening recommendation, and so insurance pays for it. But you may get some copay for something like anesthesia or pathology. We're trying to train more local physicians in doing endoscopy so that in rural areas, maybe travel becomes less of a barrier. Some of my residents who've graduated from here who I've trained are now practicing out in Yuma, Colorado, out on the Eastern Plains and doing endoscopy there. And so, if we can continue to train providers, not only the knowledge to recommend colon cancer screening, but the skills to actually do an endoscopy when it's needed, that will break down a lot of barriers and hopefully can meet some of those, less supported patients where they are.